Hello, welcome to SSVF 300 Entry, Exit, and SSVF Assessment. I'm your trainer, HMIS Program Specialist, Cindy Flores. For the remainder of this webinar, we will be working in Client Point module within Service Point. This is a section in Service Point where you enter new clients and access existing client records. Supportive Services for Veteran Families programs provide homeless prevention and rapid rehousing services for single veterans or a veteran and their family. Homeless prevention is a set of strategies to help low-income households resolve a housing crisis that would otherwise lead to homelessness. Rapid Rehousing is a program that provides financial assistance and services to provide individuals and families from becoming homeless and help those who are experiencing homelessness to be quickly rehoused and stabilized. We will go step by step on how to correctly enter a single or family into your project or grant and complete the UDE assessment along with the SSVF program data elements on the SSVF entry assessment, which include income benefits, non-cash benefits, health insurance information, and veteran information. We will then work through how to complete the SSVF Exit assessment, and we will also work through an example of a possible scenario that may occur. Please note that if you have any questions, feel free to contact us at the HMIS Help Desk via email at hmissupport@cir.org or by phone or text at 602-908-3605. Thank you, and let's get started. Once you log into the system, it will automatically take you over to your homepage dashboard. If you work with multiple projects or grants, you will go to the top right-hand corner of the screen and click on the Enter Data As link and locate the appropriate project or grant you would need to enter in by clicking the green plus sign icon. Please note, do not use projects labeled Program. These projects are for reporting purposes only. No client data is entered here. So for this scenario, I'm going to choose NCHP SSVF Rapid Rehousing. For now, up at the top right-hand corner, right underneath Enter Data As is the Backdate Mode module. This module will be used when entering client data that happened in the past, not today. For today's example, today is 7/29/15, but I'm going to say that my client entered in on 1/1/15. I would click on the backdate link and change my date to 1/1/2015. Please make sure that the time is defaulted to 12 p.m., not a.m., and then click the Set Backdate button. Then, as you can see, the banner then turns to yellow and will remain this bright yellow while in backdate mode. Please be sure to note that the data quality policy and procedure says that all data must be entered within 7 calendar days. But for this scenario, I backdated to 1/1/15, and this is to go into the next class. Let's go over to the menu bar and click Client Point. The first step to be will to search for your client or the head of household by searching by name, Social Security, or the client's HMIS ID number here in this section. Please note that the head of household must be the veteran. So I'm going to go ahead and make up a pretend client. Entered in the first name and the last name. Please keep in mind that providing identifying information is an SSVF eligibility requirement, and this is not optional. Okay, then fill in the name data quality. Here we have full name reported, partial, street name, or code name reported. This is mostly used for outreach teams. Then we have client doesn't know, client refused, and data not collected. Please keep in mind that data not collected is considered the same as missing data. Please note, for SSVF, the only acceptable response to the name data quality is full name reported. Underneath alias, here in the alias text field box, you can add in the client's secondary name if they report two different names. For the Social Security number question for veterans, the Social Security number is relevant to eligibility. A veteran who declines to provide the Social Security number is not eligible for SSVF. So for this scenario, I'm going to go ahead and make up a social. Okay, and the same rule for the Social Security number data quality. We have full Social Security reported, approximate or partial Social Security reported, client doesn't know, client refused, and data not collected. I'm going to choose full Social Security number reported. The U.S. military veteran question is answered here on the client search screen and should be answered yes. For anyone who has ever been on active duty in the armed forces of the U.S., regardless of the discharge status and the length of service. For SSVF projects, every adult must have a veteran status of either yes or no, client doesn't know, nor client refused are permissible responses. This question can be answered on the client profile screen as well. Underneath, we have the exact match box. Please do not click the exact match box. It will not locate clients' names with misspellings. Once all of this information is filled in, click Search. If your client or head of household name populates below, as we can see, we have an exact name. So we have a possible match. You would, if this is your client, you would click on the client's name. It's a hyperlink, so it'll take you straight to the client's profile. Or you can click this edit pencil icon to go to the client's profile. But for this scenario, I'm going to say that my client is brand new. So then if your client is new, you would click Add New Client with this information. Say OK to this pop-up, which is asking you if you're sure. So after clicking OK, the system will automatically take you to the Client's Profile tab. It's said Add the Summary, but just go to the Client Profile tab. Okay, so here you can edit the client record by clicking the pencil edit icon and make any edits if you need to, or answer the U.S. military veteran question if it's not answered already. Okay, if you go over to the right-hand side, here you can upload the client's picture ID by clicking the Change button and browse from your desktop and even add a description. Once you have your picture, you would click Upload. But I'm going to cancel. Okay, let's then scroll down to Client Demographics section. This section will be blank the first time a client is entered into Service Point. Please do not ever edit. Click on the Edit Pencil icon to the left of the Client Demographic header to add or edit the client's information. This information will automatically fill in or change when an entry is created into your project through the Entry and Exit tab. Now let's go over to the AZ Client Notes section. This is a tool in the system used by some, but not all agencies, to create client progress notes. Underneath we have Client Notes. This is a section, a generic notes section. Please do not use it unless specified by your supervisor to do so. Right underneath we have File Attachments. This is a tool that can be used to attach items such as birth certificates, identification cards or important information, or any information that you may want to upload electronically. And right underneath that, we have incidents. This can be used to ban a client from your agency or certain areas within your facility, and staff has the ability to view this banned information at all times. Okay, now let's scroll up to see the rest of the tabs. To the right, we have the Households tabs. Agencies serving families will use this tab to either create new households or to update existing households. Agencies not serving families can skip this tab. If you work with families as well and would like to learn more about this in creating households, you may visit the HMIS 101B, How to Complete a UDE on Families training video. To the right, we have the ROI tab. This is used to share data among agencies. If you wish to attach a ROI to a client's record, you can do it through the File Attachments feature on the Client's Profile tab. To the right, we have the Entry and Exit tab. This tab captures when a client enters and exits a provider's project or grant. And also, this is where you would put in interims, which are updates and/or annual assessments. To the right, we have the Case Managers tab. This is where staff can assign themselves as a client's case manager electronically. You can learn more about this feature in the Case Management 200 training series. To the right, we have Case Plans. This is where goals can be set for clients. Again, you can learn more about this feature in the Case Management 200 training series. To the right, we have the Measurements tab. This tab is where you would locate self-sufficiency matrix, SPDATs, and/or FSPDATs. To the right, we have the Assessments tab. You can access the AZ client notes through this tab, and it would be located here in this section. You will also find your projects or grants assessments and have the ability to view them. This tab is no longer used for assessment entry. As mentioned before, any client information should be entered or edited through the Entry and Exit tab only. Right above, we have the Service Transactions tab. This is where all referrals and services can be recorded and viewed, along with the client's shelter stays, if your client uses the Shelter Point module. But you can learn more about this feature in Case Management 201 and 202 training series. Now I'm going to go back and click on Client Information so I can see the rest of the tabs. Now let's go over to the Households tab. So from the Head of Households record, I will go back to the Client Information to the left of the Service Transactions tab to the Head of Households tab. I will provide you with a scenario that may occur while working in the Households tab. If you're entering a single individual into your project, you can skip the Households tab and go straight to the Entry and Exit tab. If the head of household already has a household established, do not create another one. If the household is missing a member or if the relationship is incorrect, please click the Manage Household button, and it would appear here the household that's already existing, and then you would click Manage Household. But again, I will show you what that looks like once we have created a household grouping. Also, please do not delete or remove a client from a household, even if that person is not entering your project at that time. You can exclude the member by not checking the name into the project at entry. The only time you should delete a client from a household is when they are deceased. Since my head of household does not have an established household created, I'm going to go ahead and establish a household. So click Start New Household. Up at the very, very top, we have the household's type. This is where you look up the family and determine what the household definition is. HMIS can provide you with a definition for the household types, but for this scenario, I'm going to choose male single parent. Okay, here in the client search is where you would enter in your household member. So I'm going to go ahead and make up a child. So I'm going to name him Junior SSVF. Please fill out all of these questions. Full name, data quality. I'm going to make up a fake social security number for this scenario. I'm going to report that the social security number data quality is full social security reported. And the U.S. military veteran question does not have to be answered for children under the age of 18. But of course, it does have to be answered for everybody 18 and older. So then click Search. If the new household member was already in the system, the client would appear here under the Client Results section. And you would add them by clicking the green plus sign icon that would appear here to the left of the sub-assessment, and then it would drop it down to the Selected Clients section. But since this is a brand new client, I'm going to click Add New Client with this information, click OK. And then the client goes down to the Selected Client section. You can repeat the steps above to find and add new household members until everyone in the family who is entering your project is listed under the Selected Clients section. Once you have added all the household members, click Continue. Okay, then it takes us over to this screen. And here is where you will establish who the head of household is. So there can only be one head of household designated to a family, and it is typically the veteran for SSVF projects. So you would locate your head of household, change the no to a yes. The relationship to the head of household automatically populates to self. Please leave it at self. Do not determine who they are. And just double check that the child's relationship, the child's head of household says no. But please determine the relationship to the head of household by this pick list. So for this scenario, I'm going to say that the head of household's relationship is son. The relationship to the head of household for the child is son. Okay, so now that you have all of this information filled out, please make sure that the joined household's date is correct. And then click Save and Exit once you have completed that. Okay, so like I was saying, if the household is missing a member or if the relationship is incorrect, you would click this Manage Household button and manage the head of household information, the relationship, or you can add in new clients through here as well. So now that we have our household created, let's go over to the Entry and Exit tab to enter in our family into our project. So you would click Entry and Exit tab, and then click Add Entry and Exit. So the information is always going to be through the head of household. So please make sure to check all of the clients in that are entering the project. And this section here is where you could exclude a household member that is in the household composition but is not entering the client, is not entering your project by literally just not checking their name. But for this scenario, the head of household and his child is entering the project. Please ensure that the provider is correct. If it is not correct, then you are not in Enter Data As mode. Please cancel the entry command and get into the correct EDA mode first. The type is going to be VA. And also please ensure that the entry date is the actual entry date. If this is not the correct date, then you are not in the correct backdate mode. So once everything is correct, click Save and Continue. You will then see the SSVF entry assessment will open by default for the head of household first. So let's go ahead and fill out the universal data elements together. So for this scenario, I'm going to make up the head of household's date of birth. So entering the client's date of birth using a 4-digit year. So I'm going to say 1/1/1974. So every client, including non-veteran household members, must have a date of birth entered into HMIS. Note that the name data quality, client doesn't know, client refused are not valid responses for SSVF participants. So from this drop-down for date of birth type, I'm going to choose full date of birth reported. Next is a primary race question. Specify from the list of 5 races which is a primary of your client. This question has detailed information about how HUD defines these races. If you hover your cursor over the question, here it will show you the definition. So you can categorize it, or you can click on it and it'll give you a definition as well, as you just saw. So for this scenario, I'm going to choose primary race of my client to be white. The secondary race is optional. Specify from the list of 5 races which is the secondary race of your client. If they do not report one, please leave this question at select, which is blank. Do not duplicate the primary race. Ethnicity. Specify the ethnicity of your client, either Hispanic or non-Hispanic. If your client reports their race is Hispanic, but a primary race of white and the ethnicity of Hispanic. So for this scenario, I'm going to choose non-Hispanic. Gender. Specify the gender of the client if they report something other than what is the list of these 4 here. You would choose other, and right underneath we have if other gender specify text field box, and in here you would write what your client reports to be. But for this scenario, like I said, my client is a male. Does a client have a disabling condition? Choose yes or no for whether your client has a reported disability. There is additional information about HUD's definition of disability if you hover your cursor over the question. Here it gives you a definition. We also have a handout, and we will send it to you in an email. So for this scenario, I'm going to say yes. Then we have residence prior to project entry. Specify the type of residence or non-residence your client slept last night. This is a comprehensive list, but if they reported something that is not on the drop-down, then choose other, and then go to the next question and specify the type of residence or non-residence they stayed at in the text field box right underneath. So here we have emergency shelter, foster care home, hospital, hotel or motel paid without emergency shelter voucher, jail, prison, or juvenile detention facility, long-term care facilities, owned by client, no ongoing housing subsidy, owned by client with ongoing housing subsidy, permanent housing for formerly homeless persons, placement for habitation, means your client either slept outside in an abandoned building or in their home they didn't have any running water or electricity. Psychiatric hospital or other psychiatric facility, rental by client, no ongoing housing subsidy, rental by client with VASH subsidy, and VASH is Veteran Administration Supportive Housing. Rental by client with GPD TIPS subsidy is Grant Per Diem Transition in Place, and these two are VA subsidies. Then we have rental by client with other ongoing housing subsidy, residential project or halfway house with no homeless criteria, safe haven, balance of state currently does not have a safe haven, staying or living in a family member's room, apartment, or house, staying or living in a friend's room, apartment, or house, substance abuse treatment facilities or detox center, transitional housing for homeless persons, including homeless youth, other, and of course, if you choose other, please specify in the if other type of residence text field box. Then we have client doesn't know, client refused, or data not collected. For this scenario, I'm going to choose place not meant for habitation. Length of time in previous place. This question relates to the above question, residence prior to project entry. So from this drop-down list, please choose 1 day or less, 2 days to 1 week, more than 1 week but less than 1 month, 1 to 3 months, more than 3 months but less than 1 year, or 1 year or longer. I'm going to choose for this scenario 1 year or longer. Then we have zip code of last permanent address. Specify the 5-digit zip code of the place the client was housed for at least 90 days. If the client cannot remember the exact zip code, then ask which city they lived in and use the zip code of that city to complete the question. If you hover your cursor over the zip code of last permanent address, it gives you a little cheat sheet with zip codes for cities in a balance of state. So for this example, I'm going to choose 85603. Relationship to the head of household. Specify what the relationship to the head of household is. If you work with singles, then the answer will always be self, head of household. Client location. This is a continuum of care code assigned to the balance of state. There's only one option, and it is AZ500, so please choose it to complete this question. Homelessness primary reason. Specify the reason the client reports for their homelessness from the drop-down list. If you're entering a homeless prevention client, please choose client not homeless because you're providing this service. So for this scenario, I'm going to choose substance abuse. There it is. Length of time on street in an emergency shelter or safe haven. These set of questions, along with other questions in the assessment, will help determine if your client is chronically homeless. Please answer these questions on all heads of households and adults. Let's go ahead and answer these questions together. Client entering from the streets, emergency shelter, or safe haven. From this pick list to the right, answer yes if the client is entering your project directly from a place not meant for habitation, an emergency shelter, or safe haven. Answer no if the client is entering your project from any other location. Diversion in homeless prevention projects should choose no. So for this scenario, I'm going to say yes. And if yes, for clients entering from streets ES or SH, approximate date started. So if your client is coming from streets ES or SH, you should have the client look back to the last time the client was not on the streets ES or SH. I'm going to give you a few guidelines and rules to answer these questions. If there was a break in time on street ES or SH for less than 7 nights, do not count it as a break. It would be one continuous episode of homelessness. If there was a break of more than 7 nights, count a break in between episodes. If a break in time was 90 days or less due to an institutional stay, such as jail, substance abuse, or mental health treatment facility, hospital, or other similar facilities, that time should be included in the start date time. If the client was at an institutional stay for longer than 90 days, they're considered to be housed. If the client knows the month of homelessness started but not the exact day, you may use the day they are entering your project with the month and year that they reported. Documentations in HMIS may be used to only jog the memory of the client, but cannot be substituted for any information given directly by your client. So with that said, I'm going to say that the start date is 1/1 of 2013 for this scenario. Next question. Regardless of where they stayed last night, number of times a client has been homeless in the past 3 years, including today. So from this pick list, record the approximate answer of number of times homeless experienced in the last 3 years for any combination of placed on habitation, emergency shelter, or safe haven. Remember, when counting months, please use the guidelines that I just explained in the previous example, the if yes question. So never in the past 3 years should only be used by diversion and homeless prevention projects. But here we have 1 time, 2 times, 3 times, and then 4 or more times. For this scenario, I'm going to choose 2 times. Total number of months homeless on streets in ES or SH in the past 3 years. So this is asking for a count. So count the accumulated number of months the client was homeless and residing in one or any combination of these 3 locations in the past 3 years. So from this pick list, we have 1 month. This time is the first time, 2, and then 12, and we have more than 12 months. Please note, any single day or part of a month spent should be counted as 1 full month. So for this scenario, I'm going to choose more than 12 months. Then we have length of time homeless, status documented. Indicate if there is documentation on the client's length of homelessness, either in the client's paper file or HMIS, for either the number of times homeless or the number of months homeless in the past 3 years. So for this scenario, I'm going to say yes.
So now let's go over to the SSVF Program Data Elements section. Total monthly income. This is a text field box, and in here you would put in the client's total monthly income amount. If the client has no income, please put in a dollar amount of $0 for the total monthly income. Note, if the client has more than one source of income, please add them together and put in the sum in this field. Sorry about that. It just asked me to log off, but let's just scroll down and continue. Income from any source. Choose whether yes or no the client is currently receiving any form of income at entry into your project. So for this scenario, I'm going to say no. Right underneath, we have the monthly income sub-assessment. You will then use the HUD verification link to the left, right in the sub-assessment. So HUD now requires for users to ask each and every source that HUD considers income. So it's a list of sources. They do not want you to ask what kind of income they receive because they may not consider some of the HUD's considerations of income to be substantial income. So we have to answer these following questions. So click the HUD verification. You would ask your client, do you receive alimony or other spousal support? Do you receive child support, earned income, so on and so forth? So up at the very, very top are these radio buttons. So if you know right off the back that your client is not receiving any of these incomes, you can click no, and it will automatically fill in for you. So once everything is filled out, you would click Save and Exit. The HUD verification should have a green check mark now. How to change an income and when a client is employed will be covered in the SSVF 301 class. Now let's go over to the non-cash benefits from any source question. Choose yes or no to whether the client is currently receiving any form of non-cash benefit at entry into your project. So for this scenario, I'm going to say yes. Then use the HUD verification link on the right inside the sub-assessment and answer yes or no to every source of benefit on this list. So for this scenario, I'm going to say that my client is receiving food stamps. So another shortcut is to answer everything no, and then change the no to the yes to the appropriate benefit. So once everything is filled out, accordingly click Save and Exit. So now your HUD verification should have a green check mark. And that's what we need to pay attention to throughout when we're filling these sub-assessments out. Then we have covered by health insurance, so answer yes or no to whether the client currently has any form of health insurance at entry into your project. For this scenario, I'm going to say yes. Inside the health insurance sub-assessment, use the HUD verification link to the right, and in the pop-up, answer yes or no to every source of health insurance on this list. So for this scenario, I'm going to say they're receiving Access. And please keep in mind that Access is considered Medicaid in the state of Arizona. So I'm going to answer everything no, and then change the no to yes to the actual health insurance. It just saves us a few seconds, and it is a shortcut, so you can use it if you wish. So once we have everything answered, click Save and Exit. So now let's go down to these questions. Currently in school or working on a degree? Answer yes or no. Received vocational training? Yes or no. Highest level of education attained? From this drop-down, please choose which one they've received. In permanent housing. This is initially collected at entry. The response at the time will typically be answered no unless your project is able to move participants into the permanent housing on the very first day of program. So this will be answered no. The move-in date is for Rapid Rehousing clients only. When in permanent housing is yes, you will be asked to enter the move-in date. This should be the date during enrollment that the participant moved into permanent housing. Clients are entered into Rapid Rehousing once they are determined eligible, but it often takes a few weeks to find an apartment and get moved in. In most cases, this question at entry will be answered no because it takes a few weeks for the client to move into their apartment. Once the client moves in, then add an interim update, and this will be done to document the actual move-in date, and this will be covered in the SSVF 301 class. Right underneath, we have the veteran information. This sub-assessment must be completed on the veterans. Click the Add button. So here we have year entered, the military service, and year separated from the military service. We'll provide you a handout on how to fill out this information. Record the year entered and year separated for veterans' longest continuous period of service. If two continuous periods of service are identical in length, and one was during a combat era and the other one was not, record the year entered and year separated for the combat era period of service. If two continuous periods of service are identical in length and neither or both were during a combat era, record the year entered and year separated for the most recent period of service. So I'm going to put in here my client's dates. Right underneath, we have theaters of operation. Identify whether or not the veteran served in the theater of operations for any of the listed military conflicts. Only physical presence within the geographical area during the conflict is required for a yes response. This is not a question of whether or not the veteran was in combat or ever came under fire. Answer no if they did not serve. Do not leave these questions blank. So I'm going to go ahead and answer accordingly. Answer yes for Vietnam and everything else no for this scenario. Other peacekeeping operations of military intervention. Answer that no for this scenario. Branch of military. From this drop-down, record the branch of military in which the veteran served for the longest period of time. If the periods of service are identical in length, see the instructions related to the year entered and year separated. So like I said, we will provide you a handout. So you can just go based off of the rules for year entered and year separated from military service. So for this scenario, I'm going to choose Navy. Discharge status. From the drop-down, please record the veteran's discharge status. For veterans with multiple discharges under different conditions, please record the best discharge status. So for this scenario, I'm going to choose honorable. Once everything is filled out, just click Save. Percentage of AMI, area median income. Used to indicate if household income is less than 30%, 30% to 50%, or greater than 50%. This must be answered for the head of household. Let's go down to last permanent address. This is where the client was housed for 90 days or more. So in the sub-assessment, click Add, and this should be answered for head of household and adults. So list the address of emergency shelters should not be recorded here. Record the street, city, state, zip code, and then apartment room if applicable, or where the client was housed for at least 90 days or more. So I'm going to go ahead and answer this fictitiously. Give me 1 second. Clients, city, state, and then zip code. There it is. Please fill out this as best as you can, but these are the requirements for the last permanent address section. So address of emergency shelter should not be recorded here. In a separate field, record the address data quality. So here you would put in the address as best as the client's information they have given you. So I'm going to say full address reported for this scenario. You can leave the start date as the defaulted date and then click Save.
These next set of questions are required to be answered upon project entry for the SSVF data export. HP screening score. Record the 2-digit integer number for the head of household. SSVF grantees must enter the homelessness prevention threshold score for each at-risk household served in their project. You may leave this question blank if you are serving a Rapid Rehousing client. VAMC station number. You can record up to 8 characters. This is required for head of households. The VA will provide SSVF grantees with the VA Medical Center station number that corresponds to their service location. So for this scenario, I'm going to choose 345.
So if you're working with the single, you will be done at this point. You would click Save and Exit. Saving your entry and the universal assessments and switching to another family. So we would just click Save and then scroll up, and in this box to the left of the SSVF entry assessment, you would answer this information for the child. The children's assessment requires less data to be filled than adults. The BOS SSVF assessment question handout is in your confirmation email, and this cheat sheet tells you which questions to answer for the client's head of household, adults, and or children. So we'll go through this together. So a requirement for the child would be the date of birth. I'm going to go ahead and make up a date of birth for the child. We'd have to fill in the date of birth type, primary race, ethnicity, gender, relationship to the head of household. So from the drop-down, please choose accordingly. Then scroll down to the SSVF program data elements. So here, the only question that needs to be answered is covered by health insurance. So I'm going to say yes for this scenario. And I'm going to say they're also receiving access. So in the sub-assessment for health insurance, you would click the HUD verification link, answer everything no, and then change the no to a yes for the appropriate health insurance, which Medicaid is access. Then click Save and Exit once everything is filled out. Then scroll down, and you do have to answer the in permanent housing question. And this question, as you can recall, was answered no for the head of household, so it would be the same for the child. So once everyone's data is complete, check everything is green, and we see that everything is green, and then click Save and Exit. Then it takes us back to the client's Entry and Exit tab for the head of household. Now we're going to do an exit scenario. So I'm going to go ahead and get out of backdate mode by clicking the X next to the full backdate date at the top right-hand corner of the screen, and I'm going to exit the client on today's date. So I'm going to show you a live scenario. So I'm going to go over to the home screen. So let's go over to the client point module on the menu bar, and I'm going to search my client by my client's name. So in here is test SSVF, and then click search. My client is an existing client, so search down here for client results, and you can either choose your client's name, or click the edit pencil icon to open it up. And it takes you over to the summary tab or the client profile tab. So to exit the client, go to the entry and exit tab. And in the same column you have your entry, click on the edit exit pencil icon in front of the empty exit date column. So you have to check everybody out of the family, so please do not forget to check the client's household member's name. Please ensure that the exit date is correct. So here we have reason for leaving. If your client's destination is not from the drop-down menu, please specify other, and in the text field box other, write down what the reason for leaving was. But for this scenario, I'm going to put completed program. But in here we have a criminal activity, death, disagreement with rules, left for housing opportunity before completing program, needs could not be met, non-compliance with program, non-payment of rent, other, reached maximum time allowed, or unknown disappeared. If you choose unknown disappeared, the destination here from the pick list, you can put no exit interview completed. But let's think positive for this scenario, and I'm going to say completed program. Destination here, it looks familiar as the pick list from the residence prior to project entry. Well, we have some new ones in here. We have to move from one HOPWA funded project to HOPWA permanent housing, and HOPWA is housing opportunity for people with AIDS. Then we have moved from one HOPWA funded project to HOPWA transitional housing. Everything else pretty much looks the same. We have staying or living with family permanent tenure, staying or living with family temporary tenure. There's no concrete definition for permanent versus tenure. You can use what we use, which we would consider permanent for housing for more than 2 years, and temporary anything less than 2 years. Okay, then we have no exit interview completed, client doesn't know, client refused, or data not collected. These three here, client doesn't know, client refused, or data not collected, the VA considers them to be the same as missing information, and this counts against you on your data quality reports. So you should strive to input a real destination whenever possible. So for this scenario, I'm going to choose rental by client, no ongoing housing subsidy. Here is notes. You can put in here notes about the client's exit. Once you have everything filled out, click Save and Continue. If none of your client's program data elements change, you should then scroll all the way down to the bottom and click Save and Exit. But if they do change, please only edit the information as it's going to be taught in the SSVF 301. Do not delete any information, or remove any information, or end any information just because a client is exiting. You want to see how they exited, with what benefits, insurance, or income they were receiving at exit. The housing assessment questions are only filled out by homeless prevention projects. So if anything changed, you would, of course, change it for the child as well. Please do not forget to do that. So once everything is filled out accordingly, you would click Save and Exit. It will automatically take you over to the entry and exit preview pane. And then you will see your project name, type VA, entry date, exit, and then the client would had any interims. The interims would show up here. And the client count, if you click on the icon, you'll see the family size there. Okay, so by following these steps and working through the system, you have now completed SSVF 300. As a reminder, if you have any questions, feel free to contact us at the HMIS Help Desk via email at hmissupport@cir.org or by phone or text at 602-908-3605. So now I'm just going to show you a summary. BOS SSVF 300 Summary. According to the BOS HMIS Data Quality Plan, you must enter clients into the system within 7 calendar days. The U.S. military veteran question is initially answered on the client search screen, but it can also be answered on the client profile screen. When creating a household, you must go through the Households tab. There can only be one designated as the head of household, and it must be the veteran for SSVF projects. When creating an entry, you must go through the Entry and Exit tab. Client demographic information should be recorded on the Entry and Exit tab through the SSVF Entry Assessment. HUD considers zip code of last permanent address or last permanent address to be where the client was housed for 90 days or more. Remember these points when completing the length of time on street, in an emergency shelter, or safe haven section. Only answer yes to the first question. Client is entering your project directly from the streets, in an emergency shelter, or a safe haven. The exception is if they were in an institutional setting for less than 90 days and came from one of those locations just before being institutionalized. When entering the date the client's current episode of homelessness started, you may use their current entry day into your project if they cannot remember the exact day. For example, if their entry date to your project is 10/3/2015, but they only remember their last episode of homelessness starting in May sometime, then you may put a start date of 5/3/2015. Count the number of times a client has been homeless in the past 3 years, even if they are not entering your project directly from the streets, emergency shelter, or safe haven. Only use never in the past 3 years for diversion or homeless prevention because the question says to include today as an episode. Add up the accumulated months of homelessness during the past 3 years, where the client was either in the streets, in an emergency shelter, or a safe haven. Any single day or part of a month counts as one full month for this question. If a client enters with no income, put a 0 in the total monthly income text field. In the state of Arizona, access is considered Medicaid. When completing the veteran information section, please remember that the year entered military service should be the actual date. At least a month and year is fine. They entered the service and not their entry date into your project. All questions in the veteran information section should be completed. Please answer either yes or no for each theater of operation listed. Percentage of AMI must be answered for veteran or head of household using these ranges: greater than 50%, 30% to 50%, or less than 30%. The HP screening scores applies to homeless prevention projects only. It should be a 2-digit integer. The VAMC station number applies to all SSVF households. It should be 8 or less characters. When creating an entry, be sure to go through the Entry and Exit tab and use the Edit Exit pencil icon to exit your family from your project. When working with the homeless prevention client or family, be sure to answer the Housing Assessment at Exit question on everyone in the household.
By following these steps and working through the examples and a scenario, you have completed training on SSVF 300 Entry, Exit, and SSVF Assessment. As a reminder, if you have any questions, feel free to contact us at the HMIS Help Desk via email at hmiSupport@cir.org or by phone or text at 602-908-3605. Thank you, and please refer back to your training confirmation email for further instructions.